post-COVID, because of house-related work from home, bad posture, not sitting with a good ergonomics, many people have developed a very odd shoulder position, where when you sit on a desk, there is a slouch to the shoulder, you droop down to look on your desk, you droop down to look on your screen. Eventually, over a period of time, you start developing a shoulder blade which looks odd if you see from behind or in the mirror. One shoulder will usually look higher than the other shoulder. What happens next? You don't feel any pain, it is just seen cosmetically, but then one day you decide to develop some healthy habit and you decide to go to the gym. You start doing shoulder exercises which involves loading the shoulder in the form of push-ups or pull-ups, exercises which involves dumbbell taking your shoulder above the shoulder level, and then your shoulder starts paining suddenly. You take a break for maybe 2-3 days, still the pain doesn't subside. Or maybe you start going to a recreational sports, commonly badminton these days. You play for a day or two and you start getting a shoulder pain, which doesn't again subside with a rest or a break for a couple of days to weeks. So what is it? What is that shoulder pain? Patients come to us, we look at the patient, we ask the patient to stand with back facing towards us, and we see a shoulder blade which is typically tilted up and in front. What is that? That is called as shoulder dyskinesia or imbalance of scapula or the shoulder blade. It has happened because of muscle imbalance due to a bad working posture over a period of months and years. Slowly and steadily, the shoulder develops a very awkward position which usually doesn't give you any pain while you're doing your routine daily work. But as you go and load the shoulder by doing any over shoulder exercises or activities, the shoulder starts giving you problem because of the abnormal position or awkward position of the shoulder blade. Your shoulder muscle, which is the rotator cuff muscle, starts getting loaded in a very wrong position, and then it starts developing swelling and inflammation. What we call it as shoulder impingement or tendinosis. Now what to do next? You visit the doctor sees you, we examine you, and if you are diagnosed with that shoulder dyskinesia problem, we usually try to do certain investigations in the form of X-rays, if necessary MRI. But essentially the diagnosis depends on the treating shoulder surgeon's physical examination.